Hello from Jonathan and me. Welcome to the programme.
First tonight, it is the second most common cause of death for men. In fact, every hour a man dies from prostate cancer in the UK. But in a breakthrough, Cambridge scientists have now discovered that prostate cancer can be divided into 5 different genetic groups.
This knowledge could one day allow patients to find out how aggressive their form of cancer is and help them decide whether or not they need to be treated with radical surgery. Elodie Harper reports.
About half of all men who live to 75 will develop prostate cancer. For most, this will be such a mild form of the disease they won't be affected, but for some, it's a life-threatening condition. The difference in treatment is huge. For the most aggressive cancer, the whole prostate needs to be removed, but this can result in life-changing side effects. The difficulty for doctors like Alistair Lamb at Addenbrooke's is deciding how aggressive the cancer is and how radical treatment should be. He hopes that may become easier after investigations he's done with cancer research at Cambridge have identified 5 different genetic types of the disease.
We already divide men into different risk groups based on a blood test called PSA, looking at the tumour under the microscope, that's called the Gleason score, and X-rays, MRI scanning. But what we've done here is we've undertaken an in-depth analysis of the genetics, the genes that are turned on and off in a large group of men with prostate cancer. And we effectively added that to what we already know about prostate cancer in order to better divide men into these risk groups which do poorly or well in terms of outcome.
For patients like John Bridge, it's an encouraging development. In 2009, he was diagnosed with prostate cancer. Having seen his father die from the condition, he chose a radical form of treatment and is now cancer-free. He says more accurate information for patients would be a huge improvement.
The thing is that on all of the different options that are available to you, there are side effects. And clearly people want to know whether or not the aggressive nature of the prostate cancer they may have is one where they need to get rid of it as quickly as possible, or they could actually undergo the other treatment and maybe consider that the side effects of that are not quite as bad.
The research into prostate cancer is the second time this month that Cambridge has been at the forefront of the fight against cancer. Researchers at Addenbrooke's were among those who recently discovered 10 genes for breast cancer. This month, they launched the 5-year bra code campaign.
As we can see, one size simply doesn't fit all. Unfortunately, that's a bit like how we treat breast cancer.
This 5-year project hopes to make treatment for breast cancer as specific as measuring bra size. Dr. Lamb says the crossover between hospital and laboratory resources at Cambridge make it uniquely well placed.
Here in Cambridge we have a strong team of clinicians diagnosing and treating prostate cancer, such that men are referred to us from around the country. We've also had a large laboratory setup, so a strong clinical team and a large laboratory setup. And what we've been able to do is combine those 2 factors to undertake the study.
It may be some years before today's breakthrough in prostate cancer can be used to help patients. But scientists in Cambridge are determined to keep pushing the frontiers against cancer. Elodie Harper, ITV News.
Well, if you've been affected by the issues in Elodie's report, you can find more information. It's on our website right now. It's the usual address, itv.com/Anglia there.